And in St. Elizabeth and in other parts of Westmoreland, St. James, Hanover, and St. Elizabeth overall, it is mind-boggling. No pictures or videos can do justice for what you see when you're driving miles and miles. The smells of rotting carcasses, the flooded roads. Healthcare has been teetering on the border of collapse because of the situation at Cornwall Regional Hospital and the overcrowding in the feeder hospitals. What we're seeing now is an exacerbation of that situation, where Lucy Hospital, Noel Holmes Hospital, is pretty much non-functional. Up to over the weekend, there was no way of contacting hospitals for referrals. They would just get critical patients as fast as possible loaded into an ambulance and send them off with a hope and a prayer and what limited staff they can afford to send on that journey. The Black River Hospital has been devastated, and Salvamar Hospital, they have major infrastructural challenges, but even more so, the staff, they are also homeless. They are also living out of cars. Many of them are hungry, and many persons cannot provide health care because they do not have the resources. We appreciate that the government has now opened the NHS stores and has started to send out supplies. But we must not be fooled into thinking that a field hospital being set up means that it is an appropriate response to a catastrophe of this nature. A hospital is secondary care. There is no primary care in any of the affected parishes at the moment. This means that the clinics are closed. It means that diabetics, hypertensives, persons with heart disease, kidney disease, those who have a diabetic foot ulcer, they are not being treated. And it means that they are going to have exacerbations and complications of their diseases. And already we are seeing where those who have access to the hospitals have been flooding the hospitals. We will see in the ensuing weeks an increase in mosquito-borne diseases. Within 6 weeks, we can expect outbreaks of dengue and whatever else is lying around, waiting for these appropriate conditions to manifest. The public health inspectors, they need to be empowered immediately so that they can start their food safety checks. They can inspect for water sources that they are potable, they have not been contaminated. Basic materials